Hello again. Our Parliament will mark World No Tobacco Day tomorrow by deliberating on the Tobacco Products and Electronic Delivery Systems Control Bill. The theme for this year is "We need food, not tobacco." This day raises awareness about alternative crop production and marketing opportunities instead of tobacco. Professor Lekan Ayo-Yusuf is the director of the National Council Against Smoking, that's the eNCA, and he's the head of the School of Health Systems and Public Health at the University of Pretoria, TUCS. Joining us now in studio for more about this. Prof, good afternoon or good evening. Welcome to today, and thank you very much for making it to discuss this very important issue of tobacco. Tomorrow being World No Tobacco Day. We need food, not tobacco. What does this mean? What does this theme this year mean in the South African context?
We need food, not tobacco. I think it's important that the World No Tobacco Day around the world makes it significant or takes a theme that has a global relevance, and therefore it has relevance for the world and South Africa. As you probably know, just after the COVID, the issue of food security or food insecurity has worsened. And we also know that the same land space that is used to grow food is used to grow tobacco. So there's tobacco now competing with food. So it was about time, particularly in South Africa, where 21% of the population, or 3.7 million people, are set to be in severe food insecurity. So it's about time to focus on food security and provide food and not tobacco. Because tobacco clearly does not nourish our body, but it kills.
On Sunday night, I host another program on eNCA called We the Nation. We had a discussion, an hour-and-a-half discussion about exactly this point, food security and how to provide food to people. But it's competing on the land, it's competing with tobacco. So you want, in terms of the campaign, for that land to be used more or solely for food instead of growing tobacco.
Correct. In addition to the fact that growing it, because it's tobacco, we can talk about the supply chain, from supply to demand. So on the supply side, there's a competition with food. On the demand side, you've got youth who have to, or even adults, that use money to buy tobacco rather than buy food. For example, many studies around the world have already shown that those who smoke are less food secured. We have actually also shown in South Africa that about 2 million smokers live in homes where they actually receive child grant. So
currently in South Africa?
In South Africa.
2 million?
2 million smokers. So in other words, if you're receiving child grant because you have no income, but you have taken income to buy tobacco because it's addictive. So it is a real crisis that needs to be addressed.
Is tobacco use growing in South Africa? I mean, do you have a sense of how big it is? And I'm asking this against also the context of COVID-19 that you've mentioned earlier, because illicit trade in tobacco grew, we understand, during that time, because the government had banned tobacco, amongst other things.
Right. Tobacco growing, you said, it's not big. Tobacco growing in South Africa has naturally gone down without anybody doing anything.
The growing of tobacco? The
growing of tobacco. For example, we used to have as many as 600 commercial farmers far back in 1998. Currently, they're just about 100 or 150. And that's about 0.1% of GDP, very small amount of land. But tobacco industry would like us to believe that this is all the economy is about tobacco. So for a better part of tobacco production, there has been an increase in use post the COVID. That's what the global adult tobacco.
There's been an increase in use.
An increase in use. So yes, the temporary ban was there, but people did have access to tobacco.
So what would the main concerns be about this increase in use in tobacco in South Africa?
So there are a couple of things that we've been looking at. We know, for example, if tobacco is cheap or the cigarettes is cheap, it's easier for people to afford it and they can have access to it. Particularly concerned about youth, because adults don't start to smoke, youth starts to smoke. So the concern, particularly around this coalition called the Protect Our Necks of different organizations, is actually how do we protect this next generation because people only...
And I see one of your partners is a youth forum.
Correct, South African Tobacco Youth Forum, because they experience and they leave this old issue. So, in other words, the new tobacco users are young people. It means they had access to cheaper cigarettes. And for many years, for the last 10 years, prices have not increased significantly.
Yeah, and there are health risks. I mean, I remember a few years ago interviewing someone, one of your peers in this World No Tobacco campaign, saying that it costs the country a lot of money as well, because tobacco can lead to certain types of diseases. And on that level, the country is currently busy debating the NHI bill. I'm just wondering, from your campaign, from your side, is there an intersection? Can the NHI bill, for example, assist in your efforts?
Actually, the tobacco bill would assist the implementation or successful and effective delivery of the NHI. It's very simple. And in fact, the UK system has actually demonstrated that there's no NHI that would survive on the hospital-based services. In other words, if we just not going to prevent any of the diseases and people just going to be walking into hospitals, the system will collapse. It will for sure collapse. The studies have shown that. So in other words, prevention of diseases has to be a fundamental input to the NHI system. In other words, reduce the number of cardiovascular attacks, reduce the number of cancers so that you don't have to perform so much surgery. And that's the only way the state will be able to sustainably keep the NHI. And therefore, it's urgent that now that the NHI bill is moving forward, the tobacco bill has to be passed.
Okay, finally, as we conclude, Prof, you advocate, rather. You are advocating for this change, but the industry itself is not sitting back. You mentioned earlier that they want us to believe that they contribute more than 0.1% to the GDP. Are you aware of what they are doing currently as an industry to stop your campaigns or promote tobacco? Let's say it like that. Right.
I think to probably provide context, the industry is obviously misinforming the public. Misinforming the public. For example, when they say if we pass the bill, the industry is going to collapse, the economy is going to shrink.
People are going to lose jobs.
People are going to lose jobs. They said this in 1995 when the first bill was passed far back. Obviously, they've been paying more dividends to their shareholders. So we assure that that's not going to happen. They bring in 12 billion through excise, which comes from the smoker's pocket, not from them. But the government spends 42 billion, 14 billion in direct healthcare cost, and 28 billion from lost for when people die and they're not able to pay taxes and loss of productivity. In other words, they continue also to promote these new products like e-cigarettes, heated tobacco, to lure young people as part of a fashion, and eventually they become smokers as well, because they didn't stop marketing tobacco, cigarettes themselves. So in other words, they're doing both in order to keep people hooked on these products.
Okay, Prof, thank you very much for your time and good luck with marking World No Tobacco Day tomorrow. I know you were busy today as well, and you've made it here on this busy day. That's Professor Lekan Ayo-Yusuf, Director of the National Council Against Smoking, and that's eNCA, and also the head of the School of Health Systems and Public Health, the University of Pretoria. That's TAX. Still to come.